Well, I think we're already doing that in many scenarios. So, for example, in patients who have FLT3 mutations, we have FLT3 inhibitors that we use in the frontline setting when a patient is newly diagnosed. If they have if they're eligible for intensive therapy, we oftentimes give induction chemotherapy and add a FLT3 inhibitor, Midostaurin. In the relapse refractory setting, there's another FLT3 inhibitor that's approved, Gilteritinib, which is a bit more of a potent FLT3 inhibitor, and it's used as a monotherapy in patients who have a FLT3 mutation and have relapsed or have progressed on treatment. Recently at EHA, the European Hematology Association meeting, data was presented from a phase 3 study of yet another FLT3 inhibitor, Quizartinib, that showed survival advantage when compared to induction chemotherapy alone. And in that scenario, that is another drug that potentially might become available pending regulatory approval for newly diagnosed patients, in addition to what we have with midostaurin, for example. Another class of AML patients with available targeted therapies are those with IDH1 and IDH2 mutations. Those patients with IDH1 mutations have ivosidenib available, a potent IDH1 inhibitor that is approved for use in the relapse refractory setting as monotherapy. It is also approved for use now in combination with azacitidine for patients who are older and newly diagnosed and have an IDH1 mutation. So I think that's a very intriguing drug and potentially available for both newly diagnosed and relapse refractory patient populations. For IDH2 mutated patients, enasidenib is available in the relapse refractory setting as monotherapy and is also quite effective in that setting. Recently, there have been efforts to study a class of drugs called menin inhibitors. That drug class seems to be quite promising and intriguing in patients with NPM1 mutations and those with KMT2A alterations. In that patient population, that class of drug from multiple different companies is being studied in the relapse refractory setting, and I believe combination studies are planned. And there are two presentations that were presented in the last few years from two separate trials that showed quite promising data, but we're awaiting additional results from a larger cohort of patients.